fast. So Dr. Antonino Araco is the first to challenge himself in 5 minutes delivery talk about, and he's going to talk about microfuse ultrasound single session safety and efficacy of this kind of technique. Please.
Thank you. Good afternoon. It's a pleasure to be here. I've been using microfocus ultrasounds since 2014. I've been one of the first to introduce this technology in Italy. I was interested in the biological effect of the microfocus ultrasounds to go below the skin and reach tissues, precisely hypoderma, subcutaneous tissues, and muscle fascia. And the biological effects, two different effects. Fractional tissue contraction, because it induces thermocoagulation points where the temperature reaches over 60 degrees, and collagen regeneration. Lots of papers been published before I started to introduce this technology in Italy since 2013, showing the clinical indication for microfocus ultrasound, showing me the safety of this technology, and also the synergy of this technology with the other procedure in cosmetic surgery. Since I've already treated 874 patients, distribution, 91% are women. You see the age distributed between 35 and 65 years old. That's what's important, the clinical indication for microfocus ultrasound. This is my ptosis scale. This ptosis scale is a validated scale that measures groups in 5 different groups. I do this technology only for groups 1 to 3, so patients have to have ptosis absent, mild or moderate. This will be very important for the study I will show you in a second. And you see the distribution of my patient according to my scale. You see most of the patients are in groups 2 and 3. Operative scale, I just go quicker. Which result, clinical result I want to achieve? I want to have tissue contraction, so result in facelifting. This is what my patient has me, but also result in tissue quality. I go very quick and want to show you lots of my clinical result, but this is what we want to expect for this technology. This is what our patient has us. So we need to be able to provide these kind of results. You see in face contouring, you see in contour eyes, crow's feet, neck. But we need to wonder, clinical result, we always can expect this good result? Of course, no. Because there are different sectors involved in this. And we have addressed at university scientific research in each of these clinical aspects: age, ethnic, gender, sex. Ptosis scale for clinical indication, and today I show you the number of energy delivered. And this is what it really counts. Ultherapy, spot delivered. I show you this work. It's going to be published in PRS probably in a few months. Prospective study. Very quickly, I want to show you 2 groups, 2 homogeneous groups for all the parameters that I already said. So, same age, female skin phototype, and this important indication. Same degree of ptosis. What we change in the 2 groups? Number of spots. The only point not significant in terms of difference. And this result, we assess the result in 2 different ways. 2 independent surgeons assess the results. You see the group 1, sorry I just went too much, okay, the group 1, the surgeon assessment were not significant. The result before and after, when we delivered 420 spots, were not significant. And so the patient satisfaction questionnaire, you see the patient were not satisfied. What it means is that the energy was not enough to produce the clinical results. But when we go in group 2, and you see 1,200 spots of energy delivered, you see that there is a statistical difference in surgeon assessment and patient satisfaction. So I need to go very quick and I want to conclude that our prospective study has been the first completely independent to test the efficacy and safety of a single session. This is very important. Single session of a microfocus ultrasound as a sole treatment, because all the patient didn't receive any other treatment in the previous 6 months, and didn't receive any other treatment in the next 6 months. So the found results show that it's necessary to deliver a significant number of spot of energy in order to stimulate collagen regeneration and tissue contraction. Thank you very much for your attention.
Thank you very much. We entertain question later. The second speaker of this rush is Dr. Sophie Pei.